Hello, I'm Congressman Steve Kagen. I deeply regret I couldn't be with you in Miami today, but I'm working hard here in Washington, D.C. to craft legislation that will improve the health care of all of our patients and improve the allergy, asthma, and immunology specialty greatly. When I was back in Wisconsin during August, I heard the message very clearly that we have to fix what's broken in our healthcare system and improve on what we already have, and making certain it's at a price we can all afford to pay. This new healthcare legislation that we're working on here this week will make Medicare better and stronger. It will make for our families an opportunity to control their own destiny, putting patients first. Patients, together with their doctors, will be controlling healthcare decisions once again. And we're developing new rules that will benefit consumers, making certain there's a very dynamic and competitive medical marketplace. And finally, we're going to make sure it's a price we can all afford to pay. Better and stronger Medicare, what are we talking about? We're talking about closing the donut hole in Medicare Part D by $500 in this next year, and then close it completely over the next decade. We're making certain that for preventive health care services, there'll be no deductibles and no copays for Medicare patients. There will be negotiations for the very first time between the Secretary of Health and the pharmaceutical industry, guaranteeing that we will lower the prescription drug costs for our patients who are covered by Medicare, some of them by 50% off the brand name. We're going to make sure that payment to physicians will be a reward for the value that we bring to the table. We're moving away towards the payment for volume and more towards payment for value. And we're going to begin to focus on eliminating the wasteful spending practices primarily within the hospital-based system that we have. We feel there's billions and billions of dollars of waste in the hospital process today, and that can be eliminated without sacrificing any quality whatsoever. Putting patients first and families first, putting them back into control of their own healthcare decision-making, is going to be accomplished by achieving the following goals. First and foremost, to me personally, because this is the very reason I ran for Congress, I wanted to bring an end to discrimination against any citizen due to pre-existing medical conditions. And that's in the House bill, it's in the Senate bill, it's also in the President's mind as well. So we're going to bring an end to any discrimination against our patients because of their asthma, their immune disorders, or any condition they may have. We're also putting together a standard benefit plan, a standard health benefit policy that each and every insurance carrier must offer to all citizens within regional marketplaces. Children, for the first time, will be covered on their parents' health care plan through the age of 26 until they're 27. And after all, my family's experience, the age of financial independence appears to be age 27. So this is a great thing for my family. We're going to eliminate the insurance companies' antitrust exemption. For too many years, the insurance companies on Wall Street have had the advantage of discussing prices and discussing where they're going to compete or not compete against one another. Well, we're going to totally eliminate this antitrust exemption that was given to them for so many years. And finally, we're also going to allow states to form compacts, to form agreements, to get purchasing pools so that insurance companies can finally sell their policies across state lines. Think about it. A competitive medical marketplace, using the power of the marketplace to leverage down prices for all of us. New rules to benefit consumers? How about this? We're going to end the lifetime limit on coverage for you and your family. We're going to cap the cost for Medicare Advantage programs. And this means that Medicare Advantage programs will have to measure up, and those that don't provide high-quality care will cease to exist. Those Medicare Advantage plans that do provide high-quality care at a reasonable price will get a 3% bonus payment. Coverage for preventive care. This is going to be written into the standard plan so that preventive health care services such as mammograms or colonoscopies will be covered within the health care policies. If you're sick, you will no longer be dropped by an insurance company. This is the practice of rescission, and we're bringing an end to that. And to everyone in the audience today in Miami, we're beginning to confront medical malpractice reforms by allowing some pilot programs to take place within states to find ways in which to get around this very serious problem in healthcare. Well, at the bottom line, we have to ask the question, is it going to work? I think it will. Can we afford it? Yes, we can. There'll be $150 billion of savings by negotiating rebates from drug companies. There'll be over $461 million taken into the U.S. Treasury by taxing millionaires. So, in other words, if you and your family earn $1 million in taxable income, every penny above $1 million would have an additional fee of 5.4%. So this is a minimal thing to ask of people who are doing so well in our markets. There'll be a $20 billion savings in tax revenues from device makers and also $150 billion in efficiencies all throughout the Medicare system. And this is not a cut in Medicare. This is making Medicare work better by delivering higher quality care at lower costs. Altogether, this results in a tremendous amount of both savings and new revenues. So we can afford these changes.